we were able to assess people's anxiety over the past 7 days. And we found associations with across region, age, and race. Detroit respondents had the highest anxiety scores, and they were significantly higher compared to the East, Central, and North regions of our catchment area. All age groups were significantly different from each other in terms of anxiety. The age 18 to 39 years reported the highest anxiety, age 65 plus years reported the lowest, and African Americans, interestingly, had significant lower anxiety scores compared to other groups. Next. We find a similar trend with depression. Again, age finding is there again, with youngest group having the highest depression scores. And again, African Americans reporting significantly lower depression scores compared to the other groups. So next we're going to go to cancer. We're going to go to, I believe it's cancer screening, yes. So this again, now we're dealing with subsets of our sample. Here among women aged 40 plus years. We asked before the pandemic, were you planning to have a mammogram between March 2020 and the end of the year? About 60% said yes. Did you have to postpone that mammogram? About almost a third said yes, they did. However, here we see no association with region, age, or race and ethnicity. Next, we're going to talk about, next slide, Pap tests. We have over 1,000 women aged 21 plus years. Again, about a third said they were planning to have a Pap test between March and 2020 and the end of the year, but and about a third of those women said that they postponed it. Here we do find an effective region, but that's really difficult to interpret because, again, it's compared outside the KCI catchment area. People were more likely to report postponing or delay. Again, it's a large area. So it's, again, we need to kind of drill down when it comes to that, but we do see an age effect with older respondents less likely to report delay compared to the younger respondents. Next. Here we focus on colonoscopy, again, just with the folks 50 plus years. About 16% said they were planning to have a colonoscopy, and of those, about half said they had to postpone it. Again, we find that region effect, but again, difficult to interpret. But again, we're seeing that there are much of our populations are having to delay cancer screening. And we have to think about what are the implications for that as we move forward in terms of early diagnosis, early detection and diagnosis. Next. So here I want to start talking about, this is not a core, these are not core questions across the cancer centers. This was specific to Carmanos and Michigan. I want to thank Dr. Mark Manning, who's going to be presenting next, because we talked and we both knew that it was important to capture this because along with COVID-19 and what's been going on this year, we have a kind of a different and escalated response to police and government aggression against African Americans. So we really knew that it was important to understand people's responses to what we're seeing in the news and experiencing. So, and he was already using the impact of event scale, which is commonly used to look at distress caused by traumatic events. And it's commonly used actually to look at cancer-specific distress. It's really based on, again, a PTSD model and asks about intrusion, avoidance, and hyperarousal. And we say some examples there of what those questions look like. So next, what do we find in terms of racial distress? I should also mention that this is an optional question. I'm sorry, you're hearing my dog. This is an optional question, and about 70% of respondents decided or chose to answer this question. We asked since the beginning of 2020, there have been a number of highly publicized incidents in which African Americans have been killed by citizen police officers, and we asked them about their responses to these events in the past 7 days. Next. So I apologize for the barking. I'll try to talk over him. So here we see effects across region, age, and race and ethnicity, such that Detroit and the Southeast region had the highest racial distress scores. All age groups significantly differed from each other. But again, we see the same trend with the youngest group reporting the highest racial distress and the oldest group the lowest. And African Americans reported significantly higher racial distress compared to other groups. Now, why is this important to cancer care? Next. These scores, so our racial distress is correlated with anxiety, it's correlated with depression, but even when controlling for race and ethnicity, it's associated with alcohol use change, tobacco use change, mammography delay, and Pap test delay. And this is not just among African Americans, it's across all groups. Racism and racial distress has adverse effects on everyone. So lastly, I'm going to go very quickly through our research findings here, our COVID-19 research. If you were asked today to participate in a research study to test the COVID-19 treatment? Would you agree to participate? You can see here to the left, we combined everybody who said definitely or probably no or were neutral compared to those who said definitely or probably yes. Much higher, most people saying definitely or probably no. And you can see with race, people of other races, and I should say we combined race in terms of, we compared whites, blacks, and people of other race ethnicities. People of color were far less likely to say they would participate in a research study on COVID-19 treatment. Next. We find a similar trend for, would you agree to participate in a research study to test a COVID-19 vaccine? Sorry about that. And next, if you were offered a coronavirus vaccine that had been approved by the US FDA today, would you agree to be vaccinated? So it's a little bit different. Half the people said they would be agree to be vaccinated, but again, we see the same trend with people of color being far less likely to agree to be vaccinated. So I'm just gonna, my last slide is coming up. So I'm not gonna say much in terms of discussion. These are just, again, the first pass of the data, very preliminary. I think that some of the takeaways here have to do with the younger adults, people ages 18 to 39, who are struggling. And perhaps we need to focus on providing more support to that age group. Also, we find that racism, regardless of whether it's a pandemic or not, is affecting our health outcomes. Future directions, we're going to continue doing this till we reach 2000 with a focus on people of color, men, people in other regions. We're going to continue development of data analysis plan with attention to temporal effects. The way people answer in July is going to be different from the way they answer in October. And obviously we're going to pool the data with our data with the data from other cancer centers. I have a save the date here at our community engaged research symposium. We're actually going to have the folks who are conducting the surveys at Ohio State, University of Colorado, and University of Alabama, Birmingham. They will come and speak in addition, and I will speak again on all the work that we're doing. So, and that's it. Next. And I just want to thank my team and all the people who made this possible. Thank you. And again, I'm so sorry about the dog.
Okay, thank you so much, Dr. Thompson. As I mentioned, once we get through our remaining presenters, we will entertain any questions you may have related to her presentation or others.